So we talked about the chief complaint and the HPI, and I want to just share with you how I look at the past medical history a little bit different than you've probably been taught in medical school. The past medical history is predictive of the present and also of the future. So past is prologue. You need to know what the past is before you can determine what the person's present is. And so, for example, if someone has a history of lung cancer, we'd like to know how high of a chance is this lung cancer to be causing whatever they're here to see me in Neuro-Oph for. And so in order to do that, I need to have the stage of the tumor, which means I need to know how extensive is the cancer. It can either be confined to the lung, it can be outside of the lung, it can be a widespread metastasis. So in a patient who has stage 1 lung carcinoma, that's a totally different risk than someone who has stage 4 lung cancer for whatever their complaint is. And we'd like to know what treatment the patient received. Because if they have extensive treatment or ongoing treatment, that also suggests that this lung cancer is actually active and causing whatever the problem is. So we'd like to know if they had surgery, chemotherapy, radiation, and it can also be a side effect of the treatment of the disease. So radiation, for example, has side effects that could affect us. Chemotherapy has ocular side effects that could affect us. Because it doesn't have to be the disease, lung cancer. It could be the treatment of the disease, the radiation, or a side effect of the treatment of the disease, immunosuppression from steroid treatment, of radiation therapy, and you see how that could extend along. And so the key and differentiating feature when any patient who has cancer is we need to know what the grade is, we need to know the histology, we need to know the stage, we need to know the treatment so that we can determine if there are side effects of the treatment or side effects of the treatment of the side effect of the disease. And in the past medical history, past is prologue.